What's going on, brothers and sisters? I'm Brother Tez1, and I'm bringing you another video for out of all your boxes. Today's date is April the 4th, 2020. This is going to be the Georgia Explosion update. It's the first one. This will be found under the What's Trending playlist. And again, the topic is the State of Georgia Explosion update. Please actively share, thoughtfully comment, and definitely subscribe to this channel. So let's get it. The first thing I'm going to go over is the notes. The first thing I'm going to go over is the numbers. And then I'll go over the executive order that was put out on the 1st by the governor. And then I'll answer all the commonly asked questions in reference to the executive order and what to expect here over the next 3 weeks under the executive order, and then I'll go over some notes that I took in reference to the numbers about the executive order and what's going on here. So the bulk of what I'm going to talk about up front are the numbers. I have broke them down. It is really starting to explode here in the state of Georgia. As of April the 3rd, we were sitting at 5,967 confirmed cases, with the increase of 523 cases within a 24-hour period. Now we're looking at, as of again the 3rd, 198 deaths in the state of Georgia, 22 within a 24-hour period. 3.3 mortality rate on the day, and then we've currently tested, that's private or public, government tested, I should say, government tested and commercial tested. We're looking at 265, and we tested in 24 hours, 2308. So inside the state, and this number really don't mean nothing, but I've been trying to give people a positive side of the numbers. So in theory, and this is recovery non-dead, that meaning that anybody that's not dead that falls into this number, that has it, that number is 5,769. So roughly about 200 or less or minus, plus or minus on the total confirmed cases. We're looking at a recovery of a 96.7%. So on the date, if we go back to when I first started this particular reporting, using the Georgia numbers, which was March the 9th, we're averaging per day about 230 new cases. Inside that time, since March 9th, has been 5,967. So basically all the cases that I'm reporting. Average deaths per day, again, since March the 9th is 8. New deaths since March the 9th is 198. And again, that's all the deaths I'm reporting. And that puts us at around a 2.9 mortality rate, with an average test rate of 1,549 per day, so 1,549 per day. And now that test rate is since they started testing, and since I started doing this report and looking at testing. Actually, I didn't start looking at testing for the state because they didn't start reporting it until looks like the 20th, so not very long. So that 1549 is not accurate. My more accurate numbers within the last 5 days. My average recovery rate since March the 9th is 97.5%. The average cases over the last 5 days, and this is where you'll see the huge jump. And why I say this number is exploding, and Georgia is about to be the next major hotspot, in my opinion. I'm only been looking at the U.S. and Georgia. I'm sure there's other places that's going to be major hotspots, but because I live in Georgia, that's why I'm dealing with the numbers in Georgia. Average new cases over the next 5 days, or the last 5 days, is 793. So way different than 230, almost triple that. Average new deaths over 5 days. So the first one was average new cases, which was 793, but the average new deaths over the last 5 days is 26.8. So roughly 27 deaths each day over the last 5 days. And the average testing is what the governor said over the last 5 days is about 3,000, almost 3,100. All right, so those are the numbers directly from the reports. A good portion of these numbers come out of two major regions, the Albany metro area and the Atlanta metro region. Now, Atlanta metro region makes up 3 counties, and Albany metro region makes up 2 counties. So because Albany is the hardest hit right now, I'm going to talk about their population, I'm going to talk about the number of cases, the deaths, and their mortality rate. And then I'll talk about Fulton, or Atlanta metro region, and then I'll shift over to the big board behind me. The Albany metro region has a population of about 119,000 people in it, and that consists of Dougherty County and Lee County. In those 2 counties combined, there's about 730 cases as of April the 3rd, and 38 dead. Again, that's inside Dougherty County and Lee County combined. So that would actually put that mortality rate at about 5.2%, which is almost double what it is statewide and nationally. So that's a pretty high death rate, and you know, if you've been following this like I follow this, you know, that's a pretty high death rate overall for this type of disease. With such a small population of people, if it continues to go unchecked, I can definitely say, and we'll talk about that in a minute when I get around to the big board, I can definitely say it's going to have a dramatic impact on that community. You know, and it's kind of personal to me because there's a Marine Corps base there, and I'm a Marine, and you know, so I can only imagine how that's going to affect that base, but more importantly, that community as a whole. So I did get kind of emotional about this today because outside of the numbers, you know, I just in my travels and out, you know, trying to help people and doing my work, I just know that a lot of people have been so misinformed, and so many people don't really know what to expect and what's going on. And now that, you know, my state, you know, is under shelter-in-place order, where so many other states are also too, you know, just people are caught off guard, and you know, they've been terming this as a war. And as somebody that has served in war in 3 different combat zones in the Marine Corps, you know, I was kind of mentally prepared because you know, it's one of those things where you've been in war before, you kind of know what to expect. Obviously, this is different than, you know, somebody shooting at you, but you know, it's similar in some ways, and some, you know, ways of thinking. But you know, my heart go out to you guys that's watching this video, that's supporting me. But these numbers in Georgia are really starting to explode, especially there in the Albany community. So again, those are the numbers for the Albany community, the Albany metro area. Let me talk about the Atlanta metro area, or Atlanta metro region. That population is approximately 4.2 million people. Again, that's, you know, Atlanta metro area makes up about 13 counties. Of that 13 counties, we got 1, 2, 3, 4, 5, 6, 7 counties out of that that has 100 or more cases. So in total cases in the Atlanta metro region, we're looking at 2,631 cases, with approximately 78 dead. Again, as of yesterday's date, April the 3rd, with a 2.96 mortality rate or death rate. So that's actually trending with the rest of the state. It's a little higher than the country. The country is trending about 2%. Our state is also trending a little higher than the rest of the country, at 2.9% as well. So, but you know, that again, that mortality rate, you know, it's still high. You know, it's nowhere near as dramatic as the Albany situation, which is why that, you know, everything I'm gonna be doing in terms of initiatives and programs and trying to help people, a lot of my first stuff is going to be geared towards trying to help people in Albany. You know, and I'll talk more about that as I get towards the end of this video. Those initiatives and programs I'm trying to set up and work with people through the phone and email to try to get help out there for people through my organization. So those are the numbers. Just a couple more things on this paper that I wanted to touch on. About 21 of the 100 or of the 198 dead, about 21 of those people were 56 or younger. So that's that, because a lot of people are thinking that this is not affecting younger people. You know, that's not a huge percentage. That's a little more than what? I don't know. My mind is not really working like that to do the math. You guys can do the math, but that is a relatively high number. I think in terms of how many dead versus not, or what they've been saying in terms of the age group less than 60. So what they got on here on the report, it says COVID-19 cases by age group, 0 to 17 is only about 1%. 18 to 59, believe it or not, is the largest group in terms of of cases. It's about 59%. 60 plus years of age is 35%, and then you have an unknown age at 5%. All right, so that's that for that. Let me just make sure I got everything that I'm supposed to cover on here. So let's turn around to the big board, and I know it's not quite in focus, but I'll point out everything that I want to show on this board and kind of talk about it as I go. So over here in red, you know, one of the things that the governor said in his press conference on the 1st was about, you know, when is it going to surge? And he said about 3 weeks. Well, that 3 weeks falls within the dates that he talked about in the press conference, starting today, which was the 3rd, going through April the 23rd, when he was told that Georgia hospitals would be at capacity. So that's that 3 week period. So that's the what I got here on the red is surge period in Georgia. So as of April 3rd, we again was at 5,967 cases, at a 2.9% in the entire state. That's mortality rate. So with 198 deaths, now what's in green is Albany. Albany is at a 5.2% mortality rate based on their current deaths compared to their current cases in Albany Metro. All right, so if you do the math, that's how I got that number. So looking at the numbers over the last 2 or 3 weeks, since I've really been tracking this pretty diligently, I would say, based on the data that I have, that the cases in Georgia are doubling about every 5 days. So every 5 days, if I start with 5, in 5 days I'll have 10 cases, and then 5 days from that I got 10. Now I have 20 cases, and it goes. So when I'm saying that it doubles every 5 days, that's what it means. That's the progression. So with 5,967 cases on April the 3rd, on April the 8th, we'll have, and again, these numbers are not etched in stone. They're just estimates based on the numbers. On April the 8th, we'll have about 11,934 cases in the state of Georgia, which would put us at 346 deaths at a 2.9% mortality rate. I'll come back to the Albany numbers after I get through the whole state, and we'll talk about Albany and why it is such a major issue and where's a major concern. So between the 8th and the 13th, if it plays out by the numbers, all the ICU beds will be gone. Because according to what the governor said in the press conference, there's only 450 ICU beds in the entire state of Georgia as of the press conference, which was on the 1st. So again, if it doubles again, nothing changes. By the 13th, which is when the executive order expires, we'll be sitting at approximately 23,868 cases confirmed. Alright, and that'll put us at 692 in deaths, almost 700 in deaths. And in that next period of time, from the 13th to the 18th, all the other beds in the hospital system will be gone. Alright, actually not through the 18th, through the 23rd. So this entire 2-week period, all the beds will be taken up. Alright, so now if it doubles again from 23,868 into the 18th, we'll be looking at 47,736 cases confirmed, with approximately 1,384 or 1,384 deaths in Georgia. And then at the point where he talked about where the hospital system will be at capacity in the state of Georgia, which is the 23rd, we'll be at 95,472 cases in the state of Georgia. So at that point, our scenario in here in Georgia really starts to look like New York, and that's inside of a month. That's inside of a month. That's 20 days. If this thing doesn't get under control and starts to be checked. So the deaths on that 95,472 will be 2,768 deaths in Georgia. Alright, so let me talk real quick about Albany. Again, Albany metro area, based on the current numbers, are looking at 5.2% mortality rate. If that continues and they follow the same trend as the rest of the state, which based on my analysis, but it's late, I didn't want to go too deep into it in terms of trying to see how, and largely because I don't have the data, because I hadn't been tracking it by county. I've only been really tracking it by state, and I just took the numbers for what I got off the report yesterday to say, okay, this is where Albany is based on their population, based on the number of confirmed, and based on the deaths. But if I take the pattern of 5 days, or doubling every 5 days, if I take that trend and apply it to Albany, where Albany's numbers double every 5 days, Albany will be looking at 1,400 cases, 1,460 cases on the 8th, with 76 dead. Again, doubling to the 13th. On the 13th, they'll be looking at 2,920 with 152 dead. On the 18th, they'll be looking at 5,840 confirmed cases with 304 confirmed dead. And then by the time we get to capacity, which I think in the case of Albany, they will already be at capacity, more than likely be at capacity between the 8th and the 13th. based on the size of their hospitals, from my understanding. But just for shits and giggles, if we get down to the 23rd in Albany, they'll be looking at about 11,680 cases confirmed, with about 607 people dead. Now again, this is a place with approximately, I think the number that I said, is 118,000, 119,000 people in that region. So that's when I look at the amount of cases, you know, that's almost what, 10% of the population that's affected. So dire, dramatic effect in a place, in a very small place in a very short amount of time. Let me see if I can get this camera. So yeah, my camera has an adjustment on it. All right, that's a little bit clearer. All right, and I probably should have did that at the start of the video, but it's late and my mind ain't all there. So those are the numbers. So let's talk about this executive order. I'm gonna read through it kind of briefly and talk about a few things inside of it, some stuff that I feel like people need to know, and I'll go over the questions, the commonly asked questions afterwards, and then that'll pretty much be it, because I actually already talked about most of my notes from the press conference. A lot of what he said, you know, it was kind of, especially at the beginning, was a whole bunch of mute point stuff that was already, you know, if you're paying attention, that was already in place, and, you know, really wasn't a change. He just made it sound like it was a change. The only true change was that he executed the executive order to put us under shelter in place. That was really the only true change. You know, and there was a few others, but that was the major one. How long does the Governor Kemp executive order last? Governor Kemp executive order went into effect on April the 3rd at 6 p.m. So it's currently under effect. It will expire on April the 13th at 11:59, which is a Monday. Oh, these are, that's not what I wanted to read first. Then again, maybe it was. So how long, I just answered that question. What businesses and professionals must cease in-person operations and close to the public during this time? This is a bulleted list. Bars, nightclubs, gyms, fitness centers, bowling alleys, theaters, live performance venues, operators of amusement park, dine-in services at restaurant and private social clubs. Exceptions on that is takeout, curbside pickup, delivery, dine-in service at hospitals, healthcare facilities, nursing homes, and other long-term care facilities. All right, those are the exceptions to dine-in service. Outside of those exceptions, you have to shut down. So you can't go into McDonald's and sit down and eat. Other professionals they have to close down. In-person services are estheticians, those are waxing, threading, eyelashes, and cosmetic treatments, hair designers, body art studios, commonly known as tattoo parlors, beauty shops and salons, including home shops and salons, barbershops, including home barbershops, cosmetology schools, hair design schools, barbering schools, aesthetic schools, nail care, and licensed massage therapy. So half this list falls up under mostly what is identified as cosmetology, or the field of cosmetology, that industry. So that industry is going to be dramatically impacted. A lot of folk is going to be out of work in that industry. So, and then the rest is basically entertainment and fitness. So, next page is, what is critical infrastructure? All right, for critical infrastructure, I feel like I'm missing something. For critical infrastructure entities, if your business if your business or organization will continue in-person operation, the state encourages implementation of 16 requirements. The definition of the critical infrastructure and the 16 requirements are listed on attachment A. So let's talk about attachment A so you can know what the critical infrastructure is. On attachment A, it says, is my entity critical infrastructure? What is critical infrastructure? It means a business, establishment, corporation, nonprofit corporation, or organization as defined by the U.S. Department of Homeland Security as essential critical infrastructure, and guidance dated on March the 19th, and service and revised on March the 28th, and those suppliers which provide essential goods, service, critical infrastructure, workforce, as well as entities that provide legal services, home, hospice, and nonprofit corporations and nonprofit organizations that offer food distribution or health and mental health services. Operational critical infrastructure shall not be impeded by county, municipal, or local ordinances. All right. So the 16-point bullet point that he was talking about on this is critical infrastructure. Continuing to use in-person operation. So meaning that if you are a critical infrastructure industry, you can continue to use in-person operation as long as you implement measures which mitigate the exposure and spread of COVID-19 among your workforce. Such measures may include, but not limited to, screening and evaluating for fever of 100.4, requiring workers who exhibit signs of illness to not report to work, enhanced sanitation workplace, hand washing and sanitation policies, provide personal protective equipment, prohibiting group gatherings of workers during working hours, permitting workers to take breaks, implementing teleworking where it's possible, implementing staggered work shifts, holding all meetings and conferences virtually where possible, delivering intangible service remotely where possible, discouraging workers from using other workers' phones, desks, computers, such and such, providing disinfecting and sanitation products, prohibiting handshaking and other unnecessary person-to-person contact, placing notices that encourage hygiene and hand hygiene at the entrance of the workplace, suspending the personal identification pads where possible. So pen pads where possible. So those are the protocols that if you are critical infrastructure that you have to have in place in order to operate in-person service. Now, real quick, let me talk about what critical infrastructure industries are and their priorities. So, one, the first priority in the first industry is healthcare and public health, obviously. Next is emergency services. Again, obviously, food and agriculture is 3. 4 is energy. 5 is water. Transportation is 6. 7 is government facilities, dams, bridges, and public works. 8 is communications. 9 is information technology. 10 is critical manufacturing. 11 is nuclear reactors, material, and waste. 12 is financial. 13 is chemical. 14 is defense, industrial base. And 15, which is the last one, is commercial facilities. So if you don't work in any of these industries, you are not critical infrastructure. Now, when you go into the critical infrastructure document that was given by the Department of Homeland Security, it does go into detail on industries that actually fall into some of this stuff. Like, I'm an electrician, so I actually fell into several of these, even though it doesn't specify on the surface my profession. Another one that I was curious about was like exterminators. They actually fall inside of what did they fall? I think they fell under government and facilities, and also under commercial facilities. All right. So those are critical infrastructure. So let's go back. let's go back. So if you don't fall under critical infrastructure, you fall under non-critical infrastructure. If your entity is not critical infrastructure, you shall follow the social distancing rule. Only engage in minimum basic operation. So you can't do in-person operations if you fall under non-critical infrastructure, and you can only do minimum basic operations. And there's a 22-point requirement for that. The social distancing rule, minimum basic operation, and the 22-point are listed on attachment B. So let's go over attachment B. Attachment B, your non-critical infrastructure entity shall comply with social distancing rule, meet the definition of minimum basic operations, and comply with the 20 bullets below. Social distancing rule: no business establishment, for-profit or non-profit corporation, organization, or county and municipal government is allowed to have more than 10 people gathering in a single location unless there's at least 6 feet between each person at all times. Now we'll talk about that in a minute, because it does affect one particular group, which is a matter of concern to great effect, and we'll talk about that in a minute when we get to the questions. Minimum basic operations are limited to the minimum necessary activities to maintain the value of your business. Establishment, corporation, non-profit organization, or organization provided service, manage inventory, ensure security, so on and so forth. The minimum necessities of the minimum necessary activities to facilitate employees or volunteers being able. All right, so basically, you guys can read that part. I'm gonna link this below. Let's get to the 20 requirements. Screening for fever, requiring workers that exhibit signs to go home, making sure you got hand sanitation for workplace, requiring hand washing and sanitation by all employees, providing personal protective equipment, prohibit group gatherings, doing work activities, permitting workers to take breaks, implementing teleworking where possible, implementing staggering shifts, holding meetings and conferences virtually where possible, delivering intangible service remotely, and discouraging workers from using other workers' phones and tools. That's not 20. I guess I didn't print off the rest of them, but I'll link this below, and that's pretty much it for the difference between critical and minimum basic operation. So critical infrastructure, non-critical infrastructure, and non-critical infrastructure, what are the minimums? So how does this order apply to individuals and families? Basic rule: all residents and visitors of Georgia are required to shelter in place in their residences from 6 p.m. on Friday, April the 3rd, 2020 to 11:59 p.m. on Monday, April the 13th, 2020. Shelter in place means remaining in their residence and taking every possible precaution to limit social interaction to prevent the spread or infection of COVID-19. Alright, so if you didn't get that, rewind it and play it again. Alright, that's what this means. Are there exceptions to the basic rule? Yes. A resident or visitor of Georgia is not required to shelter in place if they are, number one, engaging in essential services. Alright, what is an essential service? Means obtaining necessary supplies, services for a household, engaging in activities essential for health and safety of your household, engaging in outdoor activities. As long as you stay 6 feet apart, you can go to the grocery store, medical appointments, and the pharmacy. So that's where you can go. Again, I'm going to say that again. You can go to the grocery store, medical appointments, and the pharmacy. You can pick up food. You can have food delivered. You can leave your house to buy supplies to clean and maintain your house. You can go outside to exercise. You can leave your house in an emergency. The key takeaways is that you do not need to stay in your house, or excuse me, the key takeaway is that you need to stay in your house as much as possible. But we recognize there are circumstances when you would need to leave. Keep those circumstances rare. Consolidate trips as much as possible, and use takeout, curbside pickup, and delivery service wherever possible to prevent the spread of COVID-19. Alright, so those are essential services. So again, when you ask the question, are there exceptions to the basic rule, alright, in terms of the shelter in place? The answer, number one, yes, if you're engaging in essential service. Number two, if you're a worker that works inside critical infrastructure. I've already went over what critical infrastructure is. Number three, if you're engaged in non-critical infrastructure and you meet the minimum basic requirement. Again, already went over what non-critical infrastructure is and the minimum basic requirements are. The last thing that is an exception to the rule is if you're performing necessary travel. What is necessary travel? Necessary travel is travel required for someone to conduct or participate in essential services, minimum basic operations for a non-critical infrastructure business, or for a critical infrastructure business. All right, that's necessary travel. So if you work at the pharmacy and you're driving from your house to work, that's necessary travel. All right, so that's how that applies. So I think everybody got that one. How does this order apply to local governments? Basically, if your local municipal or county government is allowed to have more than 10 people gathered, basically, just to sum it up, this order supersedes any local ordinance or municipal ordinance at this time. So anything that your county, like I live in Houston County, anything that they say this, if it goes against this order, it goes out the window. Actually, even if it don't go against the order, it goes out the window. What the state says is mandated. All right. So let's talk about the commonly asked questions. And we're almost done with this video as I'm 30 something minutes in. Alright. So again, here's what you should know. When does it start? Again, I've already covered that, but just to say it again, this order took effect on April the 3rd at 6 p.m. and it ends on April the 13th at 11:59 p.m. Can you leave your house? Again, yes, you can. Georgians are allowed to leave their home and buy groceries, purchase medical equipment, go outside, exercise, respond to emergencies, head to a doctor appointment, travel to work, business for nonprofit or nonprofit that comply with other restrictions. Also do not need a letter. You also do not need a letter to prove you need to keep working. Alright. What's closed? The order mandates that all gyms, fitness centers, bowling alleys, theaters, live performance venues, everything that I've already covered. Alright, you can go back, rewind the video, and I cover everything in terms of what's closed. What about restaurants? Again, dine-in service is canceled. You can go through the drive-thru. What stays open? Again, critical infrastructure and non-critical infrastructure that meet the basic operations. What's the difference between the two? I've already explained that, but just for layman's terms, critical firms includes banks, hardware stores, utilities, key manufacturing suppliers and essential goods, legal firms, news outlets, healthcare providers, and nonprofits which specialize in food delivery and health service. All others that want to stay open must conduct minimum basic requirements, which again I've already talked about. Rewind the video and go look and see what that was. What are some of the requirements to stay open? Again, already talked about screen for fever, make sure that people got hand sanitizer, make sure that they're not gathering in groups, so on and so forth. Again, covered that already. Can you still go outside? Again, yes. That is question 4. The answer to that is yes. You can visit state parks and play sports outside, including golf, subject to certain restrictions. Gatherings of more than 10 people are banned unless you are 6 feet apart. If people congregate in certain areas of state park and golf course, for example, law enforcement will warn them to disband. If they fail to comply, they may face criminal charges. Alright, so I gave you the definition off this separate sheet because it was more specific, because I've heard a lot of reports about people on the golf course in groups or whatever, so that's why I wanted to bring that out. Again, do local restrictions still apply? No, they don't. The statewide rules override the patchwork of restrictions put out there by local government. So this is the big question, especially here in my state of Georgia. Can I still go to church or house of worship? Alright. That answer is, and this is one of them answers where they gave the answer and you gotta read between the lines. So again, the question is can I still go to church or my house of worship? So the answer is no business, establishment, for-profit or non-profit organization or county or municipal government is allowed to have more than 10 people gathered in a single location unless there is at least 6 feet between the person at all times. This rule applies to church services and funeral services. Alright? And that last sentence was put in there for a specific reason, in which the governor addressed in the press conference on the 1st in reference to 5 known cases of outbreak that stem from church and funeral services. Alright? So they didn't say no, church service can't go on, but they did say that the rule of non-essential business or non-critical infrastructure does apply in terms of the 10 feet or no more than 10 people and making sure you have the 6 feet distance. So if your church can't accommodate that rule, then they're not in compliance and subject to criminal charge. So I'm gonna just leave that right there. So next, what about childcare? Babysitters and nannies are still permissible according to Kemp's office. Does this order limit the sale of guns and ammunition? No. Shouldn't be your primary concern right now. I think toilet paper probably is more important. If you got money to buy ammo, I just think that's a poor use of funds. But that's just me. What happens if people and businesses don't comply? The expanded answer is if you violate any of the terms of this order, you are committing a misdemeanor, which is a crime in the state of Georgia. For example, if you're not sheltering in place and under the 4 exceptions of essential service, minimum basic operations, critical infrastructure, or necessary travel applies to your activities, you will receive a warning from law enforcement and risk facing criminal charges if you fail to apply. Now, from what I'm understanding is that at the time of the order, the only agency that was authorized to enforce it was Georgia State Patrol, but he had said that he was going to try, I guess, under whatever rules, to deputize sheriffs and possibly other law enforcement to enforce these rules. But I haven't seen anything out there, so as I get updates, you'll get updates. So again, also I heard that there, and I haven't, don't hold me to this, but I'm pretty sure if it's a misdemeanor, if I remember correctly from being a cop, a misdemeanor carries a weight of up to $1,000 fine. You know, obviously that's going to be subject to the judge in the court. So that's what that is. Who will enforce? I just spoke about that. On this answer it says State Patrol again, law enforcement officers, and then the governor on Friday deputized sheriff's departments to enforce closures of businesses to violate the rules. So sheriffs have already been deputized to do that. So that's pretty much it, guys. We're almost 45 minutes into this video. That's pretty much everything I wanted to talk about in terms of my home state of Georgia. I hope that you find this video informative. Got a couple initiatives, actually more than a couple initiatives going on that I'm trying to get started. I can definitely use some help. So if you want to help me put these initiatives together, I'll kindly take that help. But also I need information, and I need people to start donating money and things. So of the initiatives that I got going on, I got a mask co-op that I'm trying to put together. Put some videos out there, so masks are not as much of a concern since the CDC has changed their position on it in terms of people wearing masks. But you know, for the healthcare providers, I'm still looking at an option for them outside of the N95 and the surgical masks that can help them out. So if you're somebody that sews, or if you're a seamstress or a tailor that has sewing skills, definitely send their information over to me. I'll link my email address and the website in the comments, in the description below. And this is for everything that I'm covering, that I'm about to cover in terms of the initiatives. So this is called the Mask Co-op. Again, I'm going to be looking for people that seamstress, people that sew, and tailors with sewing skills to come together for me to provide, you know, designs for, you know, to be put together. If they provide the material, or willing to provide the material, or if I can help them provide the materials to get masks out to these healthcare workers to try to cover some of the shortfall in that need. Also, I put out a petition on yesterday called "Don't Hover, Don't Hoard." Ironically, many of the stores that I was petitioning actually put in place on yesterday and today some of the things that I was asking for on the petition. The only thing that I noticed today, that when I was out, that was still of a concern, is, yeah, they have the policies and the lines and, you know, the signs and doing all this stuff, but they're not really enforcing the physical distancing. So I don't know if much more can be done outside of them actually, you know, doing some of the stuff I saw out there today. But it is one of those things where, you know, I don't want to take that petition down quite yet, because I got to go back and check the companies that I looked at and see if they actually made it a policy, or if it's just something they're doing just, you know, out of the blue. But I think most of them will probably have a policy in place. So definitely check that out. I'll link that below as well. The next thing that I'm trying to do is a Med Pro pantry. So this is medical supplies and medical care packages for people that are working in these hospitals and long-term care facilities and places where there's COVID-19 patients. So some of the supplies that I'm gonna be looking at are going to be like air mattresses for the medical workers to have at the hospitals in the cases where they can't come home, so they'll have some place to actually lay their head when they, you know, the times when they're able to get off shift, because from my understanding, most of them are working 12 to 18 hour shifts, and a lot of times they're sleeping on, you know, hospital chairs, and, you know, just not a comfortable night's rest. And, you know, these people are working a lot of hours, and, you know, as somebody that served in combat, I know in these type of situations you don't get a whole lot of sleep, but just being able to stretch your legs and lay down makes a huge difference. So I think if people can donate air mattresses, that's definitely something that I think will help. Obviously, I know there's definitely other needs, of which I figured, you know, if the government can't get ventilators, masks, gowns, and gloves, then, you know, what's the likelihood of me, you know, Brother Tezwan getting them? So I figured I would look at other things that I can ask the public for to donate, and let the government worry about the critical needs stuff. So again, the first thing is going to be let me see if I can bring this list up. It's going to be air mattresses. I've already said that. Shower curtains are rather to be used as dividers in rooms where, you know, they can afford to put 2 people in a room. What else? So, if anybody knows anything about pressurizing rooms, definitely hit me up in the comments below, because in my research of China and Korea, I found that some of the hospitals started pressurizing rooms to keep stuff from coming in and keep stuff from getting out. I was going to do some research, but I got a lot of other stuff that I need to do, so that's not on my priority list. So if somebody can help me out and do that research for me and give me some information and we can talk about it and get it together, that'll be a great help on that. Next, I'm going to put care packages. Some of the stuff that I already have on the list is gum, Gatorade, vitamin C tablets, bottles to put water in so people can go to the water fountain, pillows, throw blankets, Tylenol. In terms of the Tylenol, I only put Tylenol because I know from my research that ibuprofen does exacerbate the COVID-19 and COVID-19 people, or, you know, symptoms. Hopefully the medical providers are not getting it, but as it's playing out, that's not the case. Tea, coffee, socks, earphones, for, you know, people got their phones, you know, they get a break and they want to take a relax, take a nap or whatever, you know, get away, be able to isolate themselves with some earphones, you know, and just take a brain break. Playing cards like Uno, regular playing cards, dominoes, personal hygiene products. Most nurses are female. You know, I don't know what the percentage is, but most nurses that I know are women. So obviously, feminine products, wipes, deodorant, soap, toothpaste, that type of stuff. Charging cables. You know, most people when they're at work, you know, it might be in their car, but you never know, and just want to have extra. Snacks like granola bars, candy, chips, you know, Little Debbie cakes, you know, jerky, ramen noodles, peanut butter, peanuts, you know, fruit, you know, anything that can help somebody's morale. That's the whole purpose of the care package. If you can think of something, I'm going to add this list to this video, and if you think of something that I can add, definitely put it in the comments and I'll add it, and we'll look at getting that as well. So that's pretty much it. I do have, and I'm going to link it, I think I'm going to put it on Scribe and just link it in the thing instead of trying to copy and paste it. The store list which has the changed hours for all or most of the major stores, at least the ones in my area, and for most places actually, I think, along with the senior hours, those who have pickup, they got floor lines, if they got, you know, point of entry and exit control, all of that will be linked on this spreadsheet, and that's pretty much it for that. I'll be creating a food and supply list. This is going to be based on stuff that I've already did, plus some. If you're like in a state like mine where you're on lockdown, stuff that you definitely need in your house, probably be putting that out tomorrow. Actually, this video at this point might not get uploaded till tomorrow. And then the final thing is I'm gonna go through the CARE Act, and that might be on a completely different video because I want to touch on that in particular by itself. So be on the lookout for that video going over the financial stuff from the CARE Act, which includes the $1,200 payments and, you know, all the stimulus money that should be coming to you, the small business stuff, the tax stuff, the unemployment stuff, the bill stuff, the bill collector stuff, all of that stuff I want to cover in one video because that's another whole different part of this scenario that I really feel like needs to be touched on. Again, this is the Georgia video. That video will probably be for everybody, rather than specifically to Georgia. And obviously all of this stuff that I just talked about will probably be on that video again too. So that's pretty much it for now. Just checking my notes, make sure I got everything. Yep. Pretty much got everything. That's it for now. I appreciate y'all watching. Thank you for your support ahead of time. You know, if you got something to say, I just ask you that you be thoughtful about what you say. In terms of comments, definitely subscribe to this channel. Most importantly, though, guys, share this video. I know it's almost an hour long, but you know, Rome wasn't built in a day, and this coronavirus is not going to go away in a day. And it's a lot of information. I hope this helps. Again, please actively share, thoughtfully comment, and subscribe to this channel. I'm Brother Tezwan. Peace and be blessed.